First of all, I just want to remind you the Medicare Reimbursement Formula. Some of you have been in this business for years and you've kind of real well versed with this. Before I jumped in and started about the conversion factor and the practice expense and the work RVUs, for those of you who may be new to this, just a reminder of how Medicare comes up with how much they're going to pay us for a particular service. And what we have to keep in mind is I can tell you what the conversion factor change is going to be, but that's not necessarily exactly what's going to affect the codes in your practice, because there's other parts of this that get tweaked a little bit. So, of course, we start out with the work RVU, which is the relative value unit assigned to the physician work. And then we have the practice expense RVU, which is that relative value assigned to the practice expense. That's your overhead. That's your staff salaries. That's, your rent, your utilities, all of that, your supplies. And then the malpractice relative value unit. Now, that's usually referred to in some areas as professional liability insurance, same thing. So that's the amount that your provider is paying for insurance to perform that one particular code. And then for each of those, you also have what's known as the GPCI, or the Geographic Practice Cost Index. And that just takes into account that it costs less to provide a service in some parts of the country than in others because of salaries and overhead and all of that taken into account. So, for example, the fees in Alabama might be a little lower than fees in New York City because of the difference there. And the GPCI is what accounts for that. And then, of course, the conversion factor. So the conversion factor is where we get adjustments made to the overall Medicare spending. So the conversion factor for next year is $32.74, which is down $1.15. Why does that work? Medicare does not have an unlimited pot of money. Surprise, surprise, none of us do. But Medicare has this particular pot of money. It can vary from year to year by no more than $20 million. That's kind of the budget neutrality idea there. So if they're going to pay for new services in the coming year, if they're going to increase the payment on a particular code in the coming year, overall, all of the money coming out from CMS to pay those Medicare claims cannot change or vary by more than that $20 million. So that conversion factor is what's used to adjust the whole thing up or down. So again, you cannot say, oh, well, we're going to get paid $1.15 less on everything we do, because so many other moving parts. And again, that's why I wanted to show you the formula to start with. Look at all those different moving parts, and they can all be adjusted really in a year. The work RVUs are adjusted or reviewed, not necessarily adjusted, but they're reviewed at least once every 5 years. And similarly with practice expense and all of the others. So those are always moving. And when we get that final dollar amount, then we might have to adjust that up or down. And that's what the conversion factor does. So I would encourage you, in addition to reading all of the information that comes from CMS, you might want to take advantage of some of the other analyses of some of these changes. And of course, I'm going to go into some detail on those. But a good place to look at some of this is the AMA, American Medical Association. They look at the impact of the dollars, and they do the big dollar work, so we don't have to. So here's a link for you, and it's just a chart showing how every specialty is going to be affected by these changes next year. And again, it's multiple changes. Some of them we're going to talk in some more detail about.